So this video is about Dincharya, and since we are doing Ayurvedic lifestyle, the two important lifestyles which we need to maintain is a daily lifestyle and a seasonal lifestyle. Daily lifestyle is called as Dincharya or daily regimen, and the seasonal lifestyle is called as Ritucharya or seasonal regimen. So we will start with Dincharya. This chapter will tell us all about how we should plan our day in terms of lifestyle. It does not tell about the work which we are doing and how do we work properly. It will tell you about the lifestyle and how to maintain the body and the mind. We have to use our own wisdom to understand that what kind and how we incorporate our work into this daily regimen. If there are certain daily changes which we need to make because of our work requirements, because of the time schedules of our work, considering that in this today's society everyone might not have the benefit or the good fortune of working only in the day hours, we have to be wise enough to understand how we can incorporate those changes without affecting the basic rhythm of our body, the basic hormonal rhythm of the body, and with minimal discomfort to the body which we face. And that we can do that when we understand what is the physiology behind it. Okay, so Dincharya can be divided into two basic headings. This is called as Prata Kala and Ratri. Obviously Prata Kala means morning regimens and Ratri Kala is night regimens, the two broad aspects of the day, which is day and night, right? A small aspect of evening is being squeezed into this regimen also, but mostly evening regimens are practiced on what not to do rather than what to do, and day and night are what you should do. Okay, so if we start with Prata Kala, as per Ayurveda, it says that you need to wake up before sunrise, two muhurtas before sunrise. One muhurat is 48 minutes, or one prahar we can say is 48 minutes, and two muhurtas would therefore will be around 96 minutes. That is around 1.5 hours on an average if you can take before sunrise. That particular hour is called as Brahma Muhurat. So the first awakening early in the morning, that procedure itself is called as Brahma Muhurat Uthishet. That means you are waking up in Brahma Muhurat. Why do we do that? That also we'll understand by the cycle of Vata, Kapha and Pitta in the body. Okay, so the procedure is we are getting up 96 minutes before the sunrise, and this 96 minutes are important. We are preparing our body and mind in these 96 minutes, and what are we doing is the stepwise process which has been given. So first thing is we are getting up at 2 muhurats before. It will maintain the physical health, the mental health, the hygiene, and a comprehensive mind and body health. It will give longevity to life. It will maintain self-protection. So the reasoning behind is that there is a lot of nascent oxygen which has been collected in the body. Nascent oxygen dissolves with hemoglobin and it forms oxyhemoglobin, which we want in our body. Oxyhemoglobin travels, that means the RBCs have picked up oxygen. It's going to travel in the body and release that oxygen. So our tissues are oxygenated. Deoxyhemoglobin would therefore be the opposite, which carries carbon dioxide and that needs to come back to the heart where the CO2 can be released off for further purification. Because this is the time where a nascent oxygen has been created, oxyhemoglobin has been created, so it's a good time. When we wake up at this hour, our body cells, RBCs, are able to release that oxygen to the tissues and the organs. The second is Ushapana, that means drinking water in the morning. They have already also specified how much water. This is exactly 640 ml, 640 ml of water, 640 ml of water before sunrise. What does this do? Other than keeping you healthy and protected and safe and all those things, the precise function of it is a sympathetic stimulus. It increases the metabolic rate by 30% and it leads to increase in the daily energy expenditure. When we are sleeping, most of the time of the day, the good rhythm to have is a parasympathetic nervous system rhythm, which is also called as vagal tone. That is the tone which keeps you relaxed. Sympathetic tone is the fight and flight syndrome. The fight and flight sympathetic tone is called as that. But because we have woken up, we need a stimulus for our sympathetic system to understand that now we are awake. We are able to process information which is being given by the environment. That stimulus is provided just by drinking 640 ml of water. Then we come to brushing of teeth, which is called as Danta Dhavana. We know what is the the good benefits of brushing the teeth. It is going to remove all the saliva which has been stagnant. It will remove the bad odor. It will bring freshness. All those things we know. In the past and still in some places we still do neem ka datun. Why is neem taken? Because it is katu, pungent, or tikta, which is bitter, or kashaya, which is astringent. These are the three tastes which we want in the mouth: katu, tikta, kashaya. What we don't want is the other: sweet, salt, and sour. Sweet things will stick, has a sticky property. It will stick to the teeth. It will increase in dental caries. Sour causes erosion of the enamel of the tooth, which is called as abrasion. Once your enamel is eroded, the enamel does not form again in the lifetime. Once it is eroded, the teeth become thin, dentin is exposed, you will have sensitivity, and you will also have increased predilection for dental caries. Salty, the mouth has an acidic pH. It has to be neutralized, but when we add salt to it, it might form the base as per the reaction of what we study in chemistry. But what happens is that in that entire process, a lot of the teeth and the soft tissues are eroded, which we don't want. It will lead to again minor injuries or micro injuries to the gums which is there. So these three tastes we don't want, but we want the other tastes which are going to be antiseptic and analgesic properties to the thing. There is a concept which is written about fluoride in this book. I do not agree with that compared to modern medicine. If you are drinking water which has fluoride in it, then you will have fluorosis because it is a systemic ingestion. But the toothpaste which we use and the content of fluoride which has is very important for the teeth to have a protective covering. Without it, the teeth are prone for dental caries. So that fluoride which is present in the tooth is in the toothpaste is important for the tooth to prevent caries. But if you are drinking a water which has high fluoride content, you will have yellowing and discolored teeth, which is called as fluorosis. Those kind of teeth are again prone for dental caries. So there is a demarcation which we need to make. For all those things where we have water with high fluoride content, that is where the iodized salt comes into being. And that is where we protect our body from not only from thyroid disorders but also from fluorosis and fluorosis disorders. The next one is Jiva Nirlekhana. That means cleaning of the tongue. We clean the teeth, we forget the tongue. Tongue is a harbinger of lot of microorganisms. It has collected a lot of food particles, microfood particles, which we cannot see because there are papillae on the tongue. And that needs to be cleaned off. If you are not cleaning that, you are giving rise to a home of bacteria. There is going to be a bad odor. So cleaning of the tongue is equally important as the cleaning of the teeth. You can do it with the same brush. You don't need a other specific tongue cleaner. If you are comfortable with the tongue cleaner, please use that. Then there are another two: gargling of the mouth and the gargling of the throat. Gandusha is gargling of mouth and throat. Specifically, if you are using a mouthwash, it is called as kavla. Okay. What is the benefit? Again, we are cleaning the soft tissues. The toothbrush and the toothpaste was for the hard tissues, which is the tooth. The other soft tissues which are present inside the mouth are tongues, buccal mucosa, lingual mucosa, gums. All those things also need to be cleaned equally, which is done with the help of these mouthwashes. The mouthwashes which are available in the market as a commercial products, they are all alcohol based. It is not wise to use them every now and then as a part of daily regimen. But in certain disease process, we do ask patients to use mouthwashes. So using homemade recipes for mouthwash. without alcohol content. That means you're dissolving it in water. And using them as mouthwash is a better alternative. What are those mouthwash? We can discuss it later on, but the process is this, right? When we use those mouthwash, we are also stimulating the respiratory center in the brain stem because of the nervous innervation of the throat and the tongue area, right? Then is Anjana. Anjana means applying kind of kajal to the eyes. It is actually a cleaning method for the eyes, because when we apply kajal, which has some herbs in it, and it is prepared in a specific way, not the commercial product, then there will be tearing in the eyes, and that tears will lead to cleaning. It will also cause stimulation of the eyesight, and it will clean the eye. Then we come to Dhoompan. Dhoompan is not smoking of tobacco cigarettes. No? It's not about nicotine. It is about medicated smoking or taking in the inhalation of smoke of herbs. What will happen is that our nasal mucosa is going to get activated, and that is the fastest route in the body for any medication to reach. It bypasses first pass metabolism of liver, and hence you can get the effect of the drug in the fastest way. Nasal inhalation is that route, okay? And it also goes directly to the brain because of the sinuses and the mucosa which is present inside the nose. It is connected directly to the brain part. Hence it helps in the diseases of the head also, which is called as Shirovaga. Then Nasya. Nasya is actually nasal drops. It's doing the same thing. It promotes and prevents the diseases of the head and neck, and the reasoning I told is because of the route. It is the fastest and rapid route. Vyayam. Now we come to physical exercise. How much exercise we need to do? We need to do exercise till 1/2 of the strength of the individual. 1/2 strength means when you as a person start sweating from forehead and armpits, that is your limit. You cannot compare yourself with the other person because their limit might be different. So one trainer cannot tell everyone to do the same exercise for the same amount of time. It is completely personal oriented, right? Then after the end of the exercise, you should go for a mild massage. What is the ideal season for exercise, which we also will do in Ritucharya, is winter and spring. There are some contraindications to exercise also. It is with those people who have diseases of Vata and Pitta. Okay? Because this exercise is going to eliminate kapha, it is helpful for those people. But if otherwise, there might be some contraindications to Vyayama also, which we should know that it exists. And if we are falling in those contraindications, then we should know what to do. If not this, then what else is possible. Why it will help? Because it will help to increase the capacity of our work doing. It will increase our digestive power. The entire play of Ayurveda is with Jataragni, the digestive power of the stomach. And we have to improve that. Right? It burns the fats and it imparts sturdiness to the body. Then we come to Abhyanga. Abhyangam means oil massage. So if you are applying it to foot, it will become Pad Abhyangam. If you are applying it to head, it will become Shiro Abhyangam. Okay. So what is done? It is done, a light massage is done with medicated or herbal oils. Right? If you are falling into a disease pattern and is there a specific disease which you have, you can use an oil which is particular to that disease. And there is a long list of that. So we can find out which, because the oils will again have their own Vata, Pitta and Kapha property. So we have to find out which one suits our body. While the most common method of massage is downward, in case of varicose veins, you have to do the opposite. Because if you do a downward massage, you'll call more of pooling, and there will be complications regarding to people who are suffering with varicose veins. So in that, the method is upward. Next comes Udvartana. So we have done oil massage. Now we are putting powder massage. So basically we are applying Uptan to our body. Instead of soap, there is Uptan. After that, we are going to take Snana, because we need to wash off all the oil and the soap which we have put on our body. What does Udvartana do? It mitigates Vata. and kapha dosha, and it also reduces the fat. So for that reasons which we are doing is we are going to shed off all those things. Snana, it is recommended to have lukewarm water for the body but not for the head. That is what it says. By lukewarm water, it does not mean very hot water or very cold water. So you have to find out what temperature of water is suitable for your body. That temperature you need to put on your body, and a lower temperature range from that. That means a little colder water for that for your head. Okay. It will remove all the tiredness, the sweat. It will maintain hygiene. It will maintain digestion. It will prolong your life. It will improve the working of the joints, the synovial fluid which is in the joints, and has so many other benefits. And particularly, it will keep you clean. Right. But we are not supposed to take bath immediately after taking food. If you are suffering from facial paralysis, then you have to be very careful of when to put water on the face. It is not advised. Mostly we wipe off with a wet towel or something. Then if you have diseases of the mouth, ears, and so basically if you have any other head and neck disorder, you need to consult. Anyways, patients who have head and neck disorders, their physicians or their oral physicians would be giving them instructions. So we don't need to worry about what are those instructions. So long as we are not falling into that capacity, we are considering ourselves as healthy. Then we are coming to Anulepa, which tightens the face, chin, and improves the vision. And this is done specifically if you're falling into that parameter where you need to apply Anulepa. Okay. Then there is Mala Dharana, which is wearing of garlands, and we see that most of us as ladies in Hindu, especially married ladies, we wear garland. It is more of a cultural benefit. When we are praying to any deity, we offer them flower garlands. It gives a sense of self-esteem. Right? So for that is the reason which is wearing. If due to any cultural reasons you are not wearing, it's fine, but you have to understand the reason behind is self-esteem. So you need to maintain a good self-esteem. If you're not, even if you don't want to, wear that mala. Okay. Then pad prakshalana, that means washing of feet, which you would have done with snan, but if it is being missed, then particularly take care of that, because it removes it says it removes the effect of Rahu. That means you are removing poverty from your life and impurity from your life. Physiologically, it will increase your lifespan, and the very good thing is it is going to improve your memory. Then we come to protective measures. Okay, this is Raksh Rogana Vidhi. This is protective measures because they are also taking into account the seasonal changes, like what kind of clothes you are wearing, Vastra Dharan, what kind of footwears you are wearing, Padartara Dharan, Danda Dharan. Do you need a stick to walk or hold a stick for your self-protection? Kavach Dharan, wearing of a protecting covering of the body. Do you need it, considering your particular circumstances? Udhishtana Dharan, wearing of turbans. Why do you want? Is there too much of heat by which you want to protect your head? And Chhatra Dharan. Chhatra means umbrella, is depending upon the season, if it's a rainy season are there. So we have to understand that yes, there are some protective measures which also fall into our daily regimen. Now we come to evening regimen, which I will discuss in my next video. Evening regimen or Sandhya Kalacharya. Evening regimen is more about what not to do, while the morning regimen was more about what to do. So in the morning regimen, the 1.5 hours which we have woken up with, in the Brahma Muhurt and before sunrise, all those things would take approximately 1.5 hours to do and would finish off by the time the sunrise is there. When the sunrise comes, there will be a change from Vata to Kapha to Pitta. Our body has already been stimulated by all the things which we have done during that morning activities or the morning charya, right? So now we are ready to work, because now our body is stimulated and our mind is highly active. So this is the time, as per also according to modern medicine, this is also called as circadian rhythm. This is actually the time when our cortisol level is high. That means I am able to do all the complex tasks of the day. So if I'm a student, I would like to study. If I am working, on some very important project which requires a lot of intellectual efforts, then I need to do it now, because my mind is activated. I can make clear decisions. My memory is activated. I will remember things well, and I will also be able to process the data which my brain has acquired. So all the brainy activities which needs to be done now. As the day will go on, my mind and body will start retiring. That is not the time when my mind will be able to make clear decisions. So I need to do all these work in the morning. And as the time of the day will proceed, the pitta and everything will get aggravated, because the sun is also getting aggravated. The heat is getting accumulated. And by the time the evening comes, again there is breeze, so vata is getting more, right? So by the time we come to evening, we need to understand what we should not do. So we have done all the morning regimens, we have done our work, we have eaten the afternoon food, the lunch, the breakfast and the lunch, both we have consumed. So everything is now in motion. Our limbs are in motion, our digestive tract is in motion, our mind is also in motion. Everything of the body has started working as it is supposed to work. By evening, what happens is that there will be a set-in of lethargy, because lactic acid will get accumulated in the body, right? So our mind will also start getting dull, our physical bodies and aches, muscles will also start to get dull. But still, by the time of evening, what we are not supposed to do, I will list out that. Ahara, we are not supposed to eat food at this evening time. If we eat it now, we will not be able to have a proper night diet. Maithuna, or sexual intercourse. Why? Let's not worry about the social instincts. The medical aspect of it is that there will be fetal abnormalities may occur due to vata vriddhi. Very, very important to understand. And since we are seeing a lot of congenital syndromes and congenital disorders happening in the children, let us try to solve those which are in our hands. So fetal abnormalities can occur if we are indulging into sexual intercourse at that time. So as per Ayurveda, it is avoided. Nidra, sleeping in the evening, it will hamper with your night sleep. Sampatham, that is reading, again because the sun has set and or is about to set, so there is less of light, so we are advised not to do reading things. But considering that we are living in a society where we have lot of other light sources, you have light which you can read, or you can have a table lamp or something. If you feel that you would like to continue reading, you can do so. But let us understand that there is a circadian rhythm in the body also which is going on. Our mind might not be able to absorb that much. Okay, so while we are reading, we might not be able to grasp the quality of read which we are doing, and it has got nothing to do with anyone's capacity of or IQ level. It has got everything to do with the body. The body is telling you that it's done. Now I have enough. Now I've already taken a lot of things in the morning. I have processed everything when I was much capable. But now is the time for me to rest. In fact, rest is the time where assimilation of information occurs. So if you are resting, you will be able to retain what you have learned better. If there is no rest and there is only putting in on information and trying to read as much as possible, there will be no memory. There will be no long-term memory and processes of the information that we have fed the mind with. Then Advagaman, that is walking. Walking because again they are saying that the light is dim, and if you are walking outside there might be insects and you might get injured. That is the only reason. Again, if you have a better light source and if you are walking indoors, it is fine. So at least use the sanity of the mind and your wisdom to understand why we are doing that, rather than adamantly saying that this is right and this is wrong. No, there's a reason given behind that. If you are able to reason out it better, do those activities. If not, let's not do it. Okay. The next part is Ratricharya or the night regimen, which I will again say in the next video. So after finishing our morning routine and our evening routine, now we have come to our night routine. night is equally important as the day, because it has almost the same hours. So if there is a 12 hours of day, there is 12 hours of night. So it requires almost the same hours of our life, of our daily regimen, right? So it is equally important to have a very good night regimen also, right? So what it says is that the first thing in at night which we are doing is ratri bhojanam, means night food or dinner. And when it should be done, it should be done within the first prahara, that means within 3 hours of sunset. So if we are assuming that sunset is happening at 6 p.m. to 6 to 9 is the maximum limit in which we can consume our dinner. Ideally 8 p.m. is what a lot of people who follow Ayurveda would suggest, that maximum you should finish your dinner by 8 to 8:30. And that would again depend upon your working schedule. So try to put in your dinner time along with these hours, and balance your work hours along with the food, because once the body has set in, it is like a machine. Our body is a machine, right? It will not be able to understand that why you are not doing it now and why you are doing it later, because the hormones have been released. Let us also try to understand that when we come into this life, when we are born till we die, we have a reserve amount of hormones in our body, and if we use them judiciously, we'll be able to expand our lifetime. And that is why a lot of people are seen to have diabetes, because they have overused the insulin which was given to them. It was enough for a lifetime, but due to certain practices we have overused it. If we understand that how the functioning of the hormones work, how much we have, we'll be able to use it for a very long time without suffering from any disorders. Okay, so we have finished our ratri bhojan. Now what we want to do is washing our hands, that is hastra prakashalam. That means we should clean the hands just for hygiene. We should also clean the teeth, which is the next, that is danta dhavanam and mukha shodhanam. Again, why? Because we have eaten food, there will be food particles which are lodged. We would like to clean the teeth and the gums as well. In fact, if we see modern medicine, night brushing is a better and more suitable option than day brushing. Day brushing we still do because of the halitosis, that means the bad odor, the bad smell which comes from the mouth. But night brushing is the one which is which will help you to have protection and prevention against dental caries, because the entire day there has been a lot of micro collection of organisms. At night when you remove it, and when you are sleeping, there is stasis in the mouth, that means the saliva is there, it is pooling. It will not be able to give rise to bacterial organisms, right? Then Trifla Rasayan. So what is it saying is that after you have done every other thing, you have had food, you have brushed your teeth, you have cleaned your mouth, you need to eat Trifla. You need to consume Trifla with ghee or honey, because it will strengthen the eyesight, it will sustain health, and it will cure disease. Strengthen eyesight, sustain health, cure disease. Then Tambula Sevna. Tambula means pan chewing. If you see from a perspective of an oral health practitioner, lot of pan chewing, especially with areca nut, supadi, and lime, chuna, has led to a lot of oral cancers and oral cancer disorders. Specific disease being oral submucous fibrosis. This pan chewing, what they are saying is not that. It should not have tobacco, it should not have areca nut. What it can have is, it can have some herbs and some spices. In fact, if you are chewing only pan leaf, that is also good. But do not add anything into it. It is the pan which has an astringent action, and that is what which we want to consume. Then we come to Nidra or sleep. I will read out what it is given, and it's something very nice. One should sit like a king after food till the fatigue of the food intake has subsided. Immediately when we consume food, we feel sleepy. Why? Because digestion is the most important process. All our blood flow has been directed to the digestive organs. So even the brain is not getting that amount of blood flow. So it is getting less oxygen. It is fatigued and it feels sleepy. Right? Because the most important process becomes digestion. So that small amount of period when we are feeling sleepy, because the blood flow is directed towards digestive organs, that is the time you should just sit like a king. It's not to fall asleep. Remain in your consciousness, but sit like a king. Then walk for about 100 steps. Then direction of sleep. Okay, so this says that if you sleep on the right side after consumption, and then a left side sleep, which will ensure proper mixing and gradual digestion of the food. So actually it is the left lateral position which is promoted a lot. Left lateral position sleeping releases pressure on the inferior vena cava veins, and helps also in digestion, which is going to happen slowly as we sleep. So left lateral is the one which is more favorable. If you have problems of gastritis and flatulence and even regurgitation, left lateral is again a better position to sleep. It will help you in taking care of the digested food and the gas which is being formed, right? Then it talks about methanum, which is sexual intercourse. It says that you can indulge in it if you like, and it also gives the seasons. Spring and autumn, the frequency is once in 3 days. In rainy and summer seasons, only once in 15 days. Okay. So if we plot out a graph, a pie chart, not a graph, let's plot out a pie chart. So imagine that there is a circle. It has been divided into 6 parts. So there is a division from 6 a.m. to 10 a.m., 10 to 2 p.m., 2 p.m. to 6 p.m., 6 p.m. to 10 p.m., 10 p.m. to 2 a.m., and 2 a.m. to 6 a.m. So the division is 6, 10, 2. Again 6, 10 and 2. What is happening in between that? From 6 a.m. to 10 a.m. That means before 6 a.m. we have done all those activities of the morning, Dincharya, and we are now ready. This is the time when kapha is activated. There is a kapha which is being formed. We are dense, we have this oily, we are sitting in one place, but our mind is highly active and we are doing the most amount of work. After 10 a.m. to 2 p.m., the sun has reached its peak. It's lot of sun. Whenever there is lot of sun and heat, it is pitta. So pitta has started being forming. So pitta is rising. From 2 p.m. to 6 p.m., the sun slows down in its energy and the wind starts blowing. So vata is aggravating. So vata is building up. Okay. From 6 p.m. to 10 p.m., again vata is slowing down, but kapha is increasing. The density and the oiliness is again started increasing. 10 p.m. to 2 a.m. is the one which we are in sleep. That times the pitta is still working. The digested food would have still given you heat, right? Because that has happened in your body. So there is pitta which is aggravating. From 2 a.m. to 6 a.m., when everything has been metabolized and assimilated, everything has gone, vata has distributed through air in your micro blood vessels and channels, the end products of the digestion. There is lightness in the body, there is distribution, there is breeze like thing. So vata is activating. So the cycle goes vata, kapha, pitta, vata, kapha, pitta. And if we understand this cycle, we can put in all our work and nature of work according to these physiological doshas which are there. So this is all about the daily regimen, and we can learn more about it by practicing it. So once you put in your daily regimen and what suits you much better, it will still take some time for your body to adapt, because you might have not been in that phase for a certain while. And different cells of the body take different time in terms of hours, in terms of weeks, in terms of months to adapt. The process of adaptation of body is in different durations. So while we keep on doing, we might not see the benefits immediately, but the benefits will show. Sometimes there are certain benefits which we don't even understand, but they still show up. And then we look back and we understand this is happened because somewhere I changed those 5 minutes of my time to do something else. And they will show up in a very long process. So that entire metabolic process, the way we tune it, it might lead to some very major changes in our lifestyle. in the way we perceive ourselves, in the way we perceive others, right? So this chapter is very important. I also feel that as if we are doing Ayurveda for lifestyle, then practicing Dincharya and Ritucharya is one of the most cornerstones of this practice. Understanding Vata, Pitta, Kapha, maintaining a daily life and maintaining a seasonal regimen. So that's it for today. Thank you.